Hi everyone, my name is Barbara Vazquez and I will be sharing my concepts and theory presentation with you all. I chose Imogene King's theory of goal attainment because of how closely her concept interacts with my CSP. Imogene King was born January 23, 1923 in West Point, Iowa. She received a Master of Science in Nursing from St. Louis University in 1957. She held multiple roles as a professor of nursing and research. She was a longtime member of the American Nurses Association. The King International Nursing Group was created to facilitate the dissemination and utilization of King's conceptual system, the theory of goal attainment. The theory reads, nursing is a process of action, reaction, and interaction, whereby nurse and client share information about their perception in the nursing situation. It explains that the nurse and patient go hand in hand in communicating information, setting goals together, and then take actions to achieve those goals. The goal of the nurse is to help patients maintain health so that they can function in their individual roles. The nurse's function is to interpret information in the nursing process, to plan, implement, and evaluate nursing care. Factors that can affect these goals for the patient are stress, space, and time. There are three interacting systems in the theory of goal attainment. These are the personal system, which goes over the concepts for the perception, self, growth and development, space, and time. The interpersonal system, the concepts for this system are communication, transaction, role, and stress. And lastly, the social system. These concepts include organization, authority, power, status, and decision making. Next, I will introduce my clinical scholarly project known as CSP and how this theory connects with my CSP. My CSP is focused on decreasing length of stay in the adult congenital heart disease unit. I will explain why this is important and later how King's theory connects with my CSP. Several studies have shown that adults are at risk for complications where their bed rest is prolonged. They rapidly lose muscle mass and strength, leading them to functional impairments. There are many ailments associated with increased length of stay, such as decubitus ulcers, muscular atrophy, pneumonia, and many others. So how does this theory relate to my CSP, and what is the significance of my CSP? So how does it relate? We know that to successfully ambulate a critical patient, nurses must plan, set clear goals to effectively execute the plan. The patients, on the other hand, may be faced with challenges such as pain, weakness, anxiety related to their hospital stay. These are the stressors and environmental setbacks. So why is early mobilization important? Why do we want to see patients' length of stay reduce? The less time a patient spends in the hospital, the less chances for complications. There are short-term and long-term complications associated with increased length of stay and prolonged bed rest. With short-term, we see delirium and muscular weakness, and with long-term, we see impacting complications such as physical, cognitive, and psychological disorders. One of the leading ICU complications is ventilator-acquired pneumonia. We can help reduce this by decreasing mechanical ventilation and mobilizing the patients early on. So why do we encourage early mobilization? Because it's safe, it's feasible, and by reducing complications, we reduce the cost of providing care to the organization as well as the patients. I hope that you have enjoyed the presentation. In this slide here, here's a list of references utilized to support the data in the presentation. Thank you all very much.